if you look at what is sexual health, so sexual health is an enjoyable sex life which is safe. If you're going to be in a relationship, you want to enjoy your sexual activity, but you want to make sure that the person is having safe sex, meaning they're not going to get their partner pregnant or they're not going to pass on STIs. I think if you are changing partners, it's probably appropriate for both people to have an STI check before they have any sexual encounters. We offer full STI checking, confidential STI checking, and we obviously treat any STIs that we actually isolate, and it's all very confidential and it's affordable. All students that come here don't have to pay a gap, so they get bulk billed. We offer different types of contraception here. We offer, barrier methods, the importance of using condoms to prevent STIs. We offer Implanon, which is a contraceptive device that goes in someone's arm, and we offer 2 types of intrauterine devices. Our expertise in contraception is quite extensive.
All right, so we have our mental health or emotional health and well-being, and then we have our physical health. But your mental health is basically how you're feeling emotionally. So most people, in fact, at some stage in their life will probably have some struggles with mental health. You may notice the physical symptoms of it, and that might be things like feeling tired, having headaches, physical symptoms of anxiety, feeling a bit shaky or breathless or racy heart. You might notice more the emotional or psychological features where you're feeling down or feeling anxious and worried, or you may notice the cognitive symptoms of it. So a good starting point is seeing a doctor, seeing a GP, and they can talk to you about what's going on, so they can assess you. Sometimes it's just a good talk that you need with someone to express how you're feeling and work through those things. But they can also help you with different things to do with your lifestyle that might help your mental health. They can put you in touch with other people who might be able to assist, whether that's a counsellor or psychologist or mental health social worker. They can advocate for you in terms of work or studies, and sometimes medication is helpful and they can help advise whether that would be useful or not.
So there's lots of different ways that you can define being healthy. And I guess that comes down to what it means to the individual, and we would tend to break things down into how they are biologically, physically, but also your social, environmental health, and then obviously a main one being your mental health. Social media would like to define that, your appearance is probably one of the most important factors of how we interpret or define health. But no, it's not the most important factor. By touching base with one of us, we would be able to go through and make sure that, we can individualise and tailor different programs or recommendations that's going to be the best fit for you, the individual. Exercise and nutrition is probably the most important thing that you can do to optimise your own health and well-being. There's only so much that we can do, with medication and other interventions, but what we find patients really benefit from is that this is something that they can, be autonomous with. We're also very lucky that we've got access to really good on-site resources, so both dietitians and exercise physiologists who can really, work out an individual program for yourself and to help you meet the goals that you're working towards.
Well, preventative health is identifying potential problems in your health and dealing with them before they become a problem. Well, everybody should have a health check, because some problems in your health, for example, high cholesterol, don't necessarily cause problems today, but can increase the risk of problems down the track. So dealing with these potential problems early helps reduce the risk of any future medical problems. So we should all be having health checks. A health check generally involves a discussion of your current medical situation, discussing any past medical problems that you've had, any current medications that you may be taking, and we would also talk to you about your family history, whether any illnesses run through your family. There are certain risk factors in your lifestyle, such as smoking, drinking, drug taking, all can impact your health. We would then generally perform a general medical examination, checking blood pressure, listening to your heart, checking through your immunisation history. Immunisation is a very important part of preventing future illness, and also bringing everything together and formulating a plan. We can offer any kind of health check, really, from a physical check to a mental health check, to a skin check, to cervical screening and immunisation check.